Pleasure of introducing our next speaker. And, it's often said that a cancer diagnosis does not define a person, and certainly that's true. But it can certainly influence a person's life and how that person grows and develops and impacts the world around them. And that's definitely true for Bella. I'm not going to tell her story because she's going to tell her own story much better than I ever could. But in thinking about Bella, it's certainly true that she's been faced with a number of challenges and that she's risen above them. And I was thinking about sort of adjectives, ways I would describe Bella. And of course, a laundry list comes to mind, but that's not very informative. And so I was sitting in my car thinking about this morning because I arrived a little early. I was sitting in the parking lot and I see, Bella walking in with her family and flashing that 1,000,000-kilowatt smile. And it occurred to me that, the way to describe her probably is best to say cheerful determination. She's overcome these things in a quietly confident way with a tremendous amount of inner strength. That strength has led her to seek out all the tools that she needs. She's engaged in a bunch of different programs over the years to learn how to navigate life despite limited vision, and has now kind of come full circle to the point where now she's teaching others how to do that through the same programs that she utilized herself. This room is a room full of people who are inspired to care for people with childhood cancer, and we all draw our inspiration from various places, and Bella's one of the places I draw my inspiration from, so I'm really excited for you all to meet her.
Okay. Good afternoon, everyone. My name is Bella Teta, and I am a second-year George Mason student, and I am studying biology, and I just want to thank you all for inviting me to speak to you all today. My journey started about 5 years or so ago, and this was during the pandemic, but back in 2019, I started noticing I had vision issues, and I went to an optometrist like any other person would to get glasses, and this was the glasses that I received was able to correct my vision, and I was able to start my freshman year of high school like any other student. But in 2020, I started experiencing other symptoms such as constant migraines, and this really made me concerned because I never experienced this before, and I decided to go to the pediatrician at the time, and they didn't know exactly what was happening, but I was given like painkillers to help out with the migraines, and they helped out a little bit, but I was ultimately referred to a neurologist to look further into the issue. And once I got to the neurologist, they told me they did like more extensive testing with eye exams, with the chart, and even balance tests. And ultimately, the balance test didn't go so well. I couldn't walk straight, and even when they did the eye exam, they noticed that I could not see through my right eye. I couldn't read any of the letters. And this was definitely it opened up my mind to potentially something that was something more than what I saw was just my vision. And they referred me to an ophthalmologist who ultimately changed my life, because once I went to this ophthalmologist, which this was during the pandemic when this was like May 2020, so there was not many ophthalmologists open at the time, and there was not that many appointments as well. So once I got to that ophthalmologist and I got an appointment, they did extensive testing with an eye exam and looking into the back of my eye with like eye pressure and whatnot. And they saw there was immense pressure in the back of my eye. They noticed that there was some sort of obstruction that was sitting on my right optic nerve, and they ultimately did not do any further testing. They just sent me straight to the ER, and that's when I knew that this was definitely a serious thing. And at this point in my life, I had really never been to the hospital or like had any serious medical conditions, so I definitely was a little bit concerned. So I was sent to Children's National and admitted, and went to my first MRI in my life, which was around 2.5 hours long. And after that MRI, I was told by the doctor at the time, and they even brought an image of my MRI scan and showed me the tumor that was on my brain. And then later, actually a couple of days later, I was admitted for surgery to remove it, and which was successful. It was removed, but I had to stay in the hospital for a couple extra days. And once I was discharged, I was able to go home. And at this time, since the tumor was removed, I could not see through my right eye because my right eye was the one that was there was so much pressure on it that once the tumor was relieved, the symptoms, the vision that was that resided back there from that was left, I guess, was ultimately gone, and I was just left with my left eye, corrected with glasses as well. And after a couple of days, something else started happening, which was I started having headaches and also fluid in my brain that was kind of like feeling like an ocean in your brain, just like moving around. And I started experiencing migraines again, and I immediately went back to the hospital to see what was happening. And it turns out I was developing hydrocephalus, which is the buildup of the cerebral spinal fluid in my brain. And that ultimately admitted me for another surgery, for a VP shunt implant permanently to drain the fluid. And this after this VP shunt surgery, the fluid was drained, but I ultimately lost all my vision because it was affecting both eyes, both optic nerves. But after this, I was able to finally be discharged with just doing routine MRIs as usual to take care of the tumor and things like that. But with this newfound blindness, I also had to complete physical therapy for a couple months, and also occupational therapy. And this was also during the time where I was starting up school again. My school was virtual at the time, so I was completing my school as well as my full class schedule, as well as learning how to be a blind person, with learning how to use a white cane, and using reading Braille assistive technology with my screen reader, and other things while going to these doctor's visits. But ultimately, and also I had to go through radiation as well to take care of the tumor at the time. And after all of this, I was able to graduate high school successfully in 2023. And at this point, I was around like 4 years into my remission plan, and it was looking pretty good for me going into college, and I was ready to start my adult life. And after graduating high school, I decided to take a gap year, and I wanted to really hone in on my independent living skills. So I decided to ask my doctors if I can get cleared to go to Colorado, because Colorado had this training center for blind people where you can live independently and learn those independent living skills for around 9 months. And once I got my routine MRI before that, I was cleared to go, and I went to Colorado, completed that training, and I even got to do like so many activities, like skiing and stuff like that. And I came back, and at this point, it was like July 2024, and I had my routine MRI as usual, and I went to my doctor's appointment as well after that, and I was told that the tumor that had been long gone for 4 years had come back, but not in the same area. The original was a central neurocytoma in the ventricle, but now it had moved, so it was growing in a different area. So I had to undergo a procedure again to remove it for a biopsy, as well as going through radiation again. And at this point, I was going to go into college, and so I was not planning on any of this, but I had to deal with it, and I had to also take a part-time schedule to my class schedule, so I could attend my doctor's appointments and radiation. And I was able to do all of that, finish my semester successfully, as well as my the next semester, which I just completed, and I was able to continue those treatments. And right now, I am studying biology. I'm in my second year right now, and I just finished my first cell biology class, which was an interesting experience. But I definitely, after experiencing all of this, I really wanted to go into cancer research and explore those fields, especially with my own experience in it, being a patient, but also just like improving accessibility for people with disabilities, because there's so much potential, and that is definitely something that I'm working on right now, getting my degree, and looking forward to in the future. But now I am in my I'm in my first year of my 5-year plan once again, for my remission plan. And yeah, honestly, my the thing that I've really took from this whole experience is just having a positive mindset, because definitely things can catch you off guard, and that's really what has shaped who I am today. But also thanking all the doctors who have helped me along the way, not just at Children's National, but my physical therapists, occupational therapists, all of them, and even my family and friends, and all of them that have helped me along the way. And this has definitely been an interesting experience, but it's definitely something that has built up my character, and I really appreciate that about this whole this whole journey that is still ongoing. And I hope to work in this field in the future. And yeah, that is all I have. But thank you, and I'm open to any questions.
Hi, thank you for sharing your story.
Mm-hmm.
I was wondering if you could share with us one interaction that you had in the health system that you felt was helpful to you, that could be replicated in other places,
Mm-hmm.
and then one experience you had that was negative that you wish we could fix.
Mm-hmm.
Thank you.
Thank you so much for that question. I would say a positive experience in the healthcare system is, I would say, when I met my eye doctor, they were really good at encouraging me. Even though they were giving me the diagnosis of being blind, they were able to give me resources to continue my life, and that really inspired me to keep going, even though it was a very challenging experience transitioning. But I would ultimately say like a negative experience, or like maybe an experience that could have been improved. I think just generally, I think sometimes people with disabilities might not be taken seriously in terms of making their own health decisions. And I think that can definitely be improved, especially with healthcare professionals, and having their autonomy in terms of making their medical decisions. And that's kind of how I would answer that.
Thank you so much for sharing your story. Just amazing. And we're so appreciative to have you here. And I absolutely see what Dr. Rood was describing with your cheerful determination. And just really, really appreciate hearing everything and your perspective on the fact that it's led you to this place. Before your talk, we heard a talk from Dr. Simons about AYA and adolescent and young adults, and how we can think about improving care for that population, which obviously you fall into. What do you have any thoughts about what we can do as a community to better support our AYA patients and families?
Yeah, I thank you so much for that question. I would say, I guess going back to that AYA presentation, I think something that I would suggest, I know when I was in the hospital, when I was like 15, so around that age, that is in that population, I would say, I guess the hospital that I was at was more geared towards like younger children, but I think just even me transitioning into adulthood, going through the system, I think I would say having more transitional services, going into the adult hospitals after having childhood cancer or childhood diagnoses, because I guess in my experience, there's not much to go off of in terms of transitional services. So maybe honing in on that, as was highlighted in the AYA program. But that's something that I would suggest.
Hey, Bella. It's Brian Rood. So over the years, you've told me about a number of things that you've done that have kind of blown me away, that you did those things. And you just mentioned skiing, and earlier we were talking and you mentioned driving. So I was wondering what has surprised you. So is there something, or maybe more than one thing, that when someone proposed to you that, okay, this is what we're going to do, and you thought, there's no way, and then you were surprised, or you surprised yourself that you were able to do that?
Yeah, I would say something that has surprised me, especially early on in my blindness journey, was meeting all the successful blind people. At the time, I didn't really know any blind people because I didn't have to think about that when I was sighted. So having to be in that community, like seeing how the endless possibilities with the fields you can go into as a blind person, and even like seeing other blind scientists, like I didn't know that that was even possible, but seeing that was definitely inspiring and kept me going into where I am today. So that has definitely surprised me, but also challenged me to even do something similar, but even more. Thank you.